Hello, I'm Dr. Mahuchi from the Eye Clinic of Florida. Patients often ask me, after cataract surgery, how does the lens implant stay in place? Well, if a picture is worth 1,000 words, hopefully the following pictures and video will help you understand how the lens implant does stay in place after cataract surgery. During cataract surgery, the eye is numbed, so the patient can't feel. A small diamond blade is used to make small incisions into the cornea, which is the clear window on the outside of the eye, so that we can work inside the eye. The patient doesn't feel any of this, which makes for a very nice experience. The eye is filled with a clear viscoelastic, which is a clear jelly-like substance which keeps everything pushed apart in the eye and gives some space for us to work. Here I add another clear liquid that helps magnify and keep the cornea moist. A special instrument is used to create an opening in the front of the lens capsule. If you think of the lens as an M&M, we're making a hole in the chocolate candy coating outside of the candy. And during cataract surgery, we're trying to just make a small hole in that outside candy coating while removing the chocolate and leaving the shell in place. And you can see, instead of a candy coating, thick colored outside to the lens, it's actually very thin, almost like saran wrap, even thinner. There are no nerves in this layer, so the patient doesn't feel any of that. So there we made an opening in the front of the lens. Here's another example. This is called, again, the capsulotomy. The front of the eye here has been dyed with or the capsule has been dyed with a special dye that allows you to see the capsule better. These tiny forceps are then used to grasp the capsule, and as you can see, we are going to make a round opening into this capsule that holds the cloudy natural lens in place. We're going to remove that cloudy lens and put a man-made lens into this bag that's left behind. Through that opening that we're making in the front of the lens, we work on the cataract through that opening, and we put the new clear lens through that opening too. And here's another example. You can see it's thin and clear and almost like saran wrap. After that portion, the lens is then separated from the bag using water. You can see the water go around the back side of the lens here. This is called hydrodissection, and the lens is freed from its capsule. Or the chocolate is freed from the candy coating shell. Ultrasound is used. Often people think it's laser, but it's actually ultrasound is used to liquefy the lens. Here we're working inside the bag that's left behind, and trying not to disrupt the bag. We're going to crack the lens into a couple of pieces here. As you can see, it freely spins inside that bag. We're not having to use much ultrasound power yet. Here we're dividing the lens into 4 pieces. This is called the divide and conquer method. And the idea is to remove these pieces of the lens from the bag while leaving the bag in place. And there we've removed one quadrant, if you will. And we're going to spin the lens around and get to the other pieces. Again, the patient doesn't feel any of this. There are no nerves inside the bag. Here the patient or the assistant added some numbing medicine. They can feel through the cornea, but usually don't because of the numbing medicine that we give. The whole procedure doesn't take very long, just a few minutes. And here we're getting that last little bit. The capsule, as you can see the round opening, if you look carefully, you can still see it there, and you'll see some remnant pieces of the lens coating the inside of the capsule. I often explain this as like the layers of an onion. And now instead of using ultrasound, we're using a vacuum to suck these pieces out, again without damaging the capsule, and you can see the nice round opening that we made at the beginning of the case is still there. So the idea is to remove the contents of the bag without disrupting the back side of the bag. So now we have the bag that the cataract or old cloudy lens was in, and this bag will now hold the new lens implant. An injector is used to fold and then unfold the lens inside that bag. As you can see, it makes for an easy way to inject the lens into the eye. There are two wire-like spring connections to the lens, and these are opened inside or dialed inside the bag, and they serve to hold the lens centered. This is another type of lens called a plate haptic lens. It's a common design on a toric or astigmatism correcting lens, and it will also go through an injector. The injector is used to go through the incision where we originally removed the cataract from, and then the lens is slowly advanced into the eye. This is a crystal lens. Crystal lens is another type of lens that moves back and forth and allows the patient to see at all distances, near, far, and everything in between. And as you can see, the lens goes nicely into the bag where the old cataract was. So the new lens implant stays in place because we preserved the capsule that Mother Nature gave us that used to hold the old cataract or old natural lens in place. We take the cataract out while leaving the capsule in to put the new lens implant in that capsule. For more questions or more answers, check out our website, seebetterflorida.com.